Welcome. This is Dr. Jen from Aging Advantage. And today I have an awesome guest for you guys. Her name is Ella, and she is with the health department. And one of the things that we're going to be really talking about and doing a deeper dive into today for you guys is a topic that is near and dear to my heart and just so important. From the standpoint, again, of just, making sure y'all get it right. And again, we did the part one series. This is going to be the part two of this presentation. But the biggest thing is, as we learned in the part one with Ella, is, about the medication management, right? And that's what we're going to be diving into a little bit deeper for the second part. But, being able to just have the knowledge and to have the safety things in place. Again, just to know where your medications are being stored, how they're being stored, keeping them up. You'll hear us discuss, what are some different tips and tricks and things that you might not be thinking about. Even, I think a lot of us think about like medications as, maybe, especially as we age, like a lot of older people they might actually still have like the medicine cabinet built into the wall. So they'll have that and it'll be up higher. Great. Other people will just put their medications sometimes like in Ziploc bags and toss them wherever. People will put them in sometimes like bins or boxes, etc., and throw them under the sink, or put them on the counter. Occasionally, also too, and this is really common, people will just leave all the bottles, all over the place on their nightstand, possibly next to their bed, or on the coffee table, or on the end table next to the couch, maybe on the kitchen counter, maybe even just on the dining room table. People leave them all over the place. Another common thing too, sometimes that we see, especially for people on the go, and depending on when their like medication reminders are happening or, when they need to actually take the medication. Sometimes we'll see people also leave all the medication bottles, or some of them at least, like in the car. And right now, with it being summer, we do not want to do that. You want to make sure, and again, you're going to see this on all the bottle labels typically, store in a cool, dry place. That does not mean in the glove box or the center console, the middle part of your car, because it is like going to be 150 degrees inside your car. With the Midwest summers that we have here. And so, we don't want to ruin the medication. So do not do that. Anyway, so you're going to hear us kind of, talk through some of those strategies and different ways to, again, to make sure, depending on if the actual medication itself is, in a bottle, in pill form. Sometimes medications are going to be in liquid form. So you're going to hear us talk about that and what that looks like, but it has to be in the fridge, how to keep that stuff safe. But anyway, we're going to just be kind of talking through again, just some different options for you all. And a couple of days ago too, I did a presentation, an educational opportunity on different apps for seniors. And some of those apps were actually medication management apps. So if you didn't check out that education video, go back and check that one out. It's helpful apps for seniors. But yeah, we discussed, some of these medication apps. And again, I think some of them can be really helpful if you, obviously use them right. Again, with any kind of reminder tool, sometimes like the more things you have in place, sometimes like the more confusing it could possibly be. So sometimes, just making a spreadsheet, literally like an Excel spreadsheet, or, just taking a piece of paper, and making grids on it, or something to where you can then put, Monday, Tuesday, Wednesday, all the days. And then if it's morning, midday, evening, when you need to be taking the pill, and literally putting it on the fridge and just going and checking the box. when you take the medication, sometimes for some people, that's effective and that's super helpful. And so, anyways, I think a lot of it, really just depends when we're talking about these medication um, topics. What's just going to be the best for your lifestyle? Like, are you primarily at home? And, that's kind of the environment you navigate in. Then again, the spreadsheet thing on the fridge might be fantastic. That might be the easiest thing for you and your family or somebody who that you're caring for, etc. Again, like other people, sometimes having the med apps are fantastic because you can add, like a kid, or again, like a sister, brother, or somebody who's caregiving for you. You can add another person to that so that they have visibility also to see and make sure that you're doing it right and that those meds are updated and all the things. And the thing with the Med app too is you obviously like you have it with you everywhere you go because when you go to the doctor, you're taking your phone with you. So you can get it out right there on the spot and you can go through you can go through your med list and make sure that it's updated properly, etc. at the doctor. If you had any different things that got added. Whereas if you have the Excel spreadsheet like on the fridge, then you might forget to like photocopy it or take a picture of it, minimum like take a picture of it with your phone, you know, before you go to the doctor's office so you can pull it up and go through it and make sure that again everything is synced properly and that you have all the all the right information. But again, I think some of it again just depends how stationary, if you will, we'll call it stationary, your life and your lifestyle is versus, are you traveling all over the place? Because let's face it, for some of you, as you get retired or you get close to retirement and beyond, y'all travel all over, you're all over the place. So for those people, again, having something like an app or something that is a grab and go with them is going to be easier than like, okay, where I had it on a piece of paper. I don't know where the piece of paper went. You know how you put the paper in the special spot and then you're like, that's fantastic. I have no idea where that special spot is, and I have no idea where that paper is, and I am never finding it again. Lovely. That happens to all of us. But, if you are a put the paper in the special spot person and then you have no idea where the heck you put it, again, maybe something like a digital technology or like the app might be a better solution for you potentially. So anyway, we're going to, like I said, cover, some of those things, especially like in the second part. And, and one of the call outs too that you'll hear us discuss as well is that, just be cognizant of the different medications. Again, there can be a lot of different formats, liquids, pills. Sometimes there can be powders and things like that as well. And, especially, or even supplements, right? Supplements, herbs, things like that sometimes too can be in powder format. And if you're taking powders, make sure that again you have the right dosage. You have the right, like teaspoon or tablespoon or half a teaspoon or whatever it is, that you have the right scooper. So teaspoon is going to be abbreviated TSP. Tablespoon is going to be like TBSP. So one has a B, one has no B. Okay. Anyway, that's kind of what you're going to be looking for. Obviously, the tablespoon one is going to be bigger. Okay. Now, with that being said, again, you want to make sure that if you are doing a powder, that you are actually taking, let's pretend this is a tablespoon or teaspoon, half a teaspoon, whatever, scooper. You want to make sure you're gonna scoop your powder, but you're gonna want to make sure that you take something and you like the backside, the flat part of a knife or something like that, like a butter knife or something to that effect, but something that's flat. and you're going to take that and run it over the top of your heaping, potentially like scoopful, to make sure that you have that dose, if you will, consistent, so that it's actually an actual tablespoon or an actual teaspoon or a half a teaspoon or whatever serving size, quote unquote, or dose of that particular thing that you're supposed to have. Obviously, liquid stuff, a little easier. A lot of times liquid stuff you'll have in those little like plastic, those little like plastic cup things with the ring circles on there. But again, pay attention to what the actual, lines are. And again, it'll say like half teaspoon, teaspoon, tablespoon, 2 tablespoons. And what I always suggest is get your handy dandy little readers if you need to, so that you can read up close what it actually says on the little cup thing. Or same thing, like on the pill bottle. Absolutely. Like get your little cheaters, get your little readers so that you can read what it says from a dosing perspective on there. When in doubt, the whole trust but verify, just double check. And especially if you're the one that is filling, pill boxes for somebody else, just doesn't hurt, just get an extra pair of eyes, literally, and put them on and make sure you're reading the label properly. Because again, if you get too much of something or too little of something, equally can be a disaster in, both ways. Not what we're trying to do. So again, just, make sure first and foremost, you got the right medication, but you want to also make sure you got the right dose. And obviously like liquid stuff, when you're putting it in like the little plastic cup thing, I'm talking about, that, you're just going to fill it up to the line, wherever the line is for the liquid. But if you have like a actual, like when you're cooking and when you're baking, right, you're going to have like the teaspoon or the half teaspoon or the tablespoon scooper that you might have. But if you're using something like that, obviously, and you pour liquid, into the divot, if you can't overfill it, because the liquid's just going to like run out everywhere, if you will. So obviously, like doing the putting something flat and pushing it off to make sure you have the right dosage isn't going to be a factor, because again, the liquid's just going to run right off and you're going to get the right dosage that way. So for some people, and again, I'm just saying this, for some people, doing a liquid, like especially like if it's a parent or somebody, again, or somebody even sometimes like with disabilities, um having like an actual scooper, like an actual teaspoon scooper or tablespoon scooper, even if it's going to be liquid, is going to be easier for them, because in case if they pour like too much into the cap, they don't always necessarily have visibility that that's too much. So anyway, just looking at different strategies, right? I think, is also going to be key. So again, we're going to discuss all kinds of fun things with you all. So stay tuned. And again, we will have Miss Ella, like I said, talk to you guys about just other, tips and tricks and things like that that you absolutely need to know. And again, I'm Jen with Aging Advantage. And again, we're a non-for-profit organization here in the St. Louis and surrounding area we serve. And, we work through grants and donations to be able to provide education programs like this to help you guys keep your confidence and your self-resilience and reliance and all the things, and for you guys to be able to be safe, not be isolated, and help work with, like again, just like safety issues that you might encounter like at home, as well as like food, acquiring food and safely handling food, etc., and things of those natures. But like I said, today we have just an important topic again about medication, the second part for you all. And again, this is just information literally that anyone, anywhere, absolutely needs to know and can absolutely benefit from. So we are excited to have Ella with us, and Ella join us again. And again, sit back, relax, get cozy, grab whatever you're drinking and go ahead and take it away, Elle. Awesome. Yay. Thank you. Thank you. We have
Absolutely.
some questions that I'm going to ask that people were asking. So, for like example, you know how there are different companies. I know Walmart is one of them, and I don't
Hmm.
know you obviously because you do this might know of more, but like that can deliver your medications to you, right?
Hmm. I know that RX Outreach does, and even if you're not eligible for the Fill the Gap program specifically, you're still able to get like that can still be your pharmacy, and you can still sign up for it. You can transfer your prescriptions that you already have over to them, and I know that they do deliver as well, and it may be or like they may have cheaper options than what you already have. So that's definitely one. Um, So one I could think of off the top of my head right now, but I know there's other ones out there.
I know that Walmart, for whatever reason, was the only one I can think of too. And I know also, like the VA does a really good job of like, they have a really great program where they just mail you all of your medications.
Hmm.
But again, like to your point though, sometimes that stuff can get tricky because like let's
Hmm.
say, let's say you met with me today and I decided to take you off of your yeah, I don't LASIK or whatever, your medication for your water pill. Like let's say we had that discussion today, but then, you get it in the mail tomorrow because another doctor had already prescribed it, and so then you get it in the mail and you're like, oh yeah, I'm supposed to take this thing, So sometimes, I think, yeah, sometimes like that, it can be confusing. So one of the questions somebody had then was to follow up, I guess, to that point is, do you recommend then that people have all of their medications through like the same pharmacy if possible? Again, just so that, the pharmacist kind of has like full visibility on that, or is like medications in pharmacy kind of database systems, are they like shared? So for example, like let's say
Hmm.
I have like five medications at Walgreens, I have two at Walmart, I have one at CVS or whatever it is, or some here or there, right? Do all those pharmacy systems like share information behind the scenes so the pharmacist that's working with your medication right then and there can make sure on their screen that what you've been prescribed isn't going to react with anything else? Or how do you recommend patients navigate all that mess, because it's a mess, let's face it, sometimes, I mean it
Yeah,
should be enough
I
anyway, but yeah, it gets messy.
yes, I yeah, I definitely understand. I would honestly say just kind of assume that they don't cross over. So if there's a Walgreens, they're specific to Walgreens. At least when it comes to like what they have in their electronic health record, you know. I don't really have experience or background in that, and like personally I stick with one pharmacy. Well, that's not true. I actually I've gone between Mercy Pharmacy and Walgreens, but as far as recommending one thing or another, it's harder to do because it just matters what works for you and what's important to you. So, if what's important to you is being able to get the most affordable medications, then you might want to have them in different places. But if that's the case, then you might want to just make extra sure that you're writing things down and you have them at your disposal to share and communicate that. So, if you feel like that piece is something that you would struggle with, then at that point I would recommend that you just keep them all in one place. So at that point then everything is at the pharmacist's disposal and they have all that information in front of them. Um, but yeah, it's one of those, it kind of depends, but whatever works the
Okay.
best.
Well, and that
So,
makes sense too, what you said about, yeah, about getting sourcing them. right? For like lower costs through this,
Mhm.
company or that company. And again, yeah, somebody who's diabetic might need to get their insulin through this company because it's going to be,
Mhm.
way more cost effective than getting it through a traditional thing. So yeah, that is a good point. But I guess too, like, is that where, and again, you have more visibility on this, but those medication app like tracker things, do you load your medications like into those? Would those kind of be able to know? Because I guess that would be handy too,
Yeah.
because then they would all just be in there, right?
Mhm. That would be a really, really good tool to use at your disposal. Yeah, those like MetaSafe, the one that I mentioned, yeah, you're able to load everything in there. Um, you're even able to like put in your doctor's appointments, and like I said, like you can put in like how often you take it, what it's for, like all those elements that make a good list, like a good foundation for what you should know and keep on file for your medications. The app is already built and designed to walk you through that process whenever you're adding medications to it. So if you do have that, I think that would make having medications at different pharmacies easier.
Yeah, absolutely. Can you, in those apps like that, can you export or print out your medication lists? Like, so, for a senior or something like that, when they go to the doctor, or like, let's say I'm taking my dad to the doctor and we have all his meds, how you said you can kind of like co-share with somebody, right?
Mhm.
Like, if you have the meds in there, I can just go in there and like print off the list and like take it with us physically, like to the doctor's office for them to scan in. Or is there some kind of like interface that can just happen with doctor's offices on those kind of apps?
I'm not sure. I'm not 100% sure on that. That's something I could definitely find out and get back to you on that if that's helpful. Um, so I haven't explored that like ability when it comes to the app. As far as it like goes with just like sharing that with doctors, I think they probably run off of their own system. So if that's like my chart, or whatever it is, actually do they, I think Okay, let me say this. I think you're able, if you already have, let's say you have your medications in my chart, I think you're able to transfer those over to the app, but I don't know if it's cross compatible. So I don't know if you list off all of your medications in the MetaSafe app that you can put them into your my chart. Um, but I would think that there was some way to like print it out or get everything out. But
Okay.
yeah, it's definitely something I can look into a little bit more.
Yeah, that makes sense. Um, one of the call outs, and again, just because I had this conversation with for one of our social workers was like, yeah, can you back me up on this conversation? I'm like, sure. And so we had this conversation the other day with the client, but one of the call outs too that I just want to add is that there are more and more people, as also like how we talked about the supplements, the vitamins, whatever, all the things, but there are more and more people also that are taking like edibles, right? So it could be like cannabis or THC or whatever, different types of like gummies, if you will, or different forms of these things. And how you were talking about just making sure you have all of your medications and all your stuff and all your things, whatever, like locked away. They, I guess, I don't know, just had them out, on the coffee table or wherever they were, and their dog got a hold of the whole entire like container. And I'm
Yeah.
like, oh, yeah, boy. Yeah. And so they were freaking out. They're like, what do I do? What do I, anyway. So we navigated that. But it made me think though, too, then even, again, like having those things around, again, you got to make sure you have even the vitamins, the supplement, all of the stuff that people have out and about and around, really
Mhm.
like locked up, because especially and we hear this, and I'm sure you guys probably do too, like more times than I want to know about, or that I want to have to hear about, because it's just like, holy cow, is like little kids, especially like they don't know a difference between I just ate, a Welch's fruit, you know, fruit chew gummy pack over here, and now I'm going to eat 5 of these little gummy thingies over there. You know, they don't know the difference between all
Yeah.
of them. So making sure you're keeping, yeah, public service announcement. Doop, doop, doop. No, I'm just kidding. No, but make sure you
Yeah.
keep like
I love it.
all the things like up and away and locked
Yeah.
away from the pets, the kids, you know, the other people in the household, etc. All the things. Um, One of the things too that I just want to call out also, you know how and this was so great, you know, in the presentation how you were talking about like people and knowing like what their medications look like. You know, obviously like for some of these patients, like when they're in the hospital, right? And then, you know, the hospital adds a new medication, but then they get released and then they have, you know, that medication that gets prescribed to them. Um, or just in general, like they get a medication that gets prescribed to them. Again, we'll say like at Walmart, and then for some reason it has to get transferred to Walgreens or whatever, vice versa. And now a
Mhm.
different pharmacy is filling it. Sometimes that pill can look completely different, even
Mhm.
though like it's the same medication, or maybe it's like the generic name, you know. So, you know, there's the regular names and then the generic names, but it's the same, you know, essentially same medication. But sometimes the pills
Mhm.
can look different too, you know, or even the same pharmacy. They ran out of the pills from one supplier, so now they got to get it from a different supplier. So the pill's going to look different. So I think, you know, to your point too, what you had said earlier, and that's just a good call out, is like, yes, you know, pay attention to what the pills usually look like in your pill boxes, but also, unfortunately, whatever you want to say, you got to pay attention to the names and all the things. I mean, this stuff can get,
Mhm.
that's where the stuff can get really kind of complicated, you know.
Mhm.
Um, with, you know, generic versus regular, and then again like what these different pills can look like. Sometimes too, and even like in the hospital we find this sometimes too. Like, let's say you're in the hospital, right? And maybe they're giving you a particular medication, you know, like through your IV,
Mhm.
right?
Mhm.
So you don't realize, oh, yeah, well, I take this thingy, you know, 3 times a day. I'm taking this med 3 times a day because they're just pumping it right in through your IV. But then you get released, and then you're like, well, I don't take this thing. I don't know what they're talking about, you know?
Yeah.
Yeah. So again, it's like, you know, they can come in all different forms and shapes and sizes, these different medications. So, yeah, when in doubt, again, to your point, you know, just ask the doctor and check with
Yeah.
them to see, or the pharmacist and, you know, check with them to
Mhm.
see, like, okay, am I supposed to be taking this thing or not, you know, or, you know, what do we have going on? Last question I wanted to ask you too is that, you know, how you were talking about different foods, right? Interacting with medications. And I know like, and I think this one has just been more, you know, talked about, if you will, but like how grapefruit, like how you shouldn't eat grapefruit, like if, you know,
Mhm.
um, if you're, you know, on statins or blood pressure meds or, you know, some anti-anxiety meds or, you know, anti-rejection meds, like after organ transplant, stuff like that. But like, are there any other kinds of, I don't know, things like that? I know you brought up alcohol. That's a really good point too, because alcohol can have some very interesting side effects that you don't want to have happen when you mix that with meds. You know, do not. Yeah, another public service announcement. Yeah, from the Dr. Jen and Ella show. Do not down your medications with a shot of vodka. Don't do it. You know, do not, yeah, take your medications with alcohol, just so that we're all clear. Yeah, but are there other kinds of like foods that you can think of? Because there's a couple that I thought of, but I just didn't know if you knew like off the top of your head any that people should kind of like be aware of also.
Honestly, no, not off the top of my head. Um,
Okay.
I
Okay,
know,
I'll
I
look
know
it
once
up.
you said grapefruit, I was like, yeah, I've heard of that, like for like, you know, like different like SSRIs or something.
Yeah.
Maybe I'm wrong, but um, to
Um,
that, I would just say that it's something to like bring up with your doctor if you're worried about it. Um, and just see, is there like is there any foods or now go to a trusted medical site online and see if you're concerned about anything. But yeah, nothing I can particularly think of at the top of
okay.
my head.
Okay, here, wait. I just looked it up really quick. Okay.
Yeah, yeah.
So Okay, all right. So grapefruit, that was actually the top one. We checked that
Yeah.
box. High five. Okay. The next one that I had said actually, oh, and I do, yep, this does make sense. Okay, green leafy vegetables. So like dark green leafy vegetables. So because they're like high in vitamin K. So people that are on like Coumadin, or like Eliquis or warfarin, stuff like that, they shouldn't eat like a high amount of the green leafy stuff because that can tend to um, counteract the blood thinning properties of the medications they're taking because it can be more
Yep.
blood clotting. So don't do that. They said, and yep, this makes sense too. Dairy products. And as soon as I
Mm,
say this, you're gonna be like, yep, yeah, calcium. Apparently, the
mhm,
calcium can be decreased absorption. So calcium can decrease absorption of certain antibiotics. Yeah, so don't take antibiotics next to calcium, but then also thyroid medications. I have heard that, like levothyroxine. If you take, yeah, thyroid medication like too close to dairy, it will
mhm,
not absorb and stuff, right?
mhm,
Let's see, potassium rich foods, they said also. So ACE inhibitors like lisinopril, ARBs, potassium sparing diuretics like spirulactone. Okay, alcohol, which we know, high five. Yeah, again, public service announcement, especially do not, as fun as this might sound, do not take your alcohol with your pain meds or your sleep medications or your anxiety medications, diabetic medications, blood thinners, or anything else for that matter. No, because obviously it's going to decrease or increase, I'm sorry, like drowsiness and bleeding risk, etc. But also, this is two more it said too, is caffeine, which that
mm,
makes sense, especially like if you're doing like a stimulant medication or some antibiotics
yeah.
sometimes, because it's going to really like jack up and increase your heart rate or blood pressure or, your jitteriness. And then the last one too, and again, there might be more, but just from this quick pull up list. And this too,
Mhm,
I'm like, oh, yep, yep, yep. You'll do the same as soon as I say this, but garlic. So like garlic, ginkgo, ginseng, turmeric, fish oil, same thing,
mhm,
right?
yep.
Because they increase bleeding when somebody's already on a blood thinner. Again, like we talked about, like with that warfarin or um, like Lovenox or Eliquis or something like that. So I was like, oh yeah,
Mhm.
But yeah, again, but if you're gonna do any of that stuff, yeah, just again, like Ella said, make sure you talk to your doctor and ask them, like, hey, I eat a grapefruit for breakfast every single morning and down it with a glass of milk. What do I do?
Mhm. Absolutely.
Yeah, or whatever. So yeah. So when in doubt, just ask, right?
Yeah. I
Um,
think
yeah.
also I want to like mention like I like antibiotics I feel like in particular are like pretty like finicky as so far as like the types of like interactions that they have with different things like and also like if you stop taking those like I wanted to kind of emphasize that point like because you should like take your entire course of antibiotics like as they're prescribed but if you do mess that up you want to know like how to recover from that and like how to make sure that you're taking like the entire dose and that it's effective so that you can effectively treat your infection and not get antibiotic resistance. Um,
Yeah,
but yeah,
that's a
just
good,
one.
yeah, that is a good call out too. Yeah, just finish, yeah, finish the course of medication, yeah, that you're on.
Yeah.
Well, and I think that goes along with also to people that, if they're prescribed, like we call it for slang, like med dose pack, right? But like a steroid pack or something like that, same thing.
Mhm.
Usually those are the ones you're going to take like 5 and then one day and then 4 the next day, 3, 2, or you'll kind of taper off. But same thing again, sometimes people like get 3 days and then they're like, yeah, I feel great, I feel fine, I feel awesome, like I'm good. And then they stop taking it. And then the pain or the whatever it was comes raging back with a vengeance. So yeah. Always want to take meds. Yeah. How the doctor prescribed. Okay. Awesome. Well, this was so helpful. Thank you. Thank you. Is there anything else that you want to share that we didn't cover before we wrap up for you?
um I don't think so. I really appreciate you bringing up those examples to like supplement like those like different like food examples because yeah, I mean that's just it's good to have that background knowledge just to kind of know. I also just want to say that all these tips as you're trying and implementing these things, like I said before, like everyone's not perfect. It's okay to, slip up, make mistakes, and just the importance is just working on it and just being able, the goal is just to be able to manage those medications a little bit easier. And it's just going to lead to better outcomes for you. And it can be an ongoing process as well, and especially when it comes to like analyzing the medicine and becoming familiar with it. Like Dr. Jen said, it can change just depending on the company that the pharmacy gets. So just always, every now and then, just checking on things, reviewing things, making edits, writing down side effects, like um, just as you go about your life, um, is just going to be helpful rather than not doing it at all. Um, and yeah, as far as I did want to talk about a little bit more about like the disposal aspect of it, um, and the storing. And the reason why I brought up pain medication specifically is because I heard a story from a colleague or an incident in which like a child went into the trash because there is like pain relief patches, and it was kind of just disposed of in the top of the trash, but they ended up like eating it, or touching on their skin. I can't remember what it was, but that's why it's just so important, the things you don't really think about, or even if
Yeah.
it's something that you think is like not really that important, like even if it's just like say like a vitamin D capsule or something, you don't know what kind of effect that is going to have like on another individual or a pet or something. So just being mindful about disposing things when you're done with them or if they're expired as well. So
Yeah,
yeah.
that's a really good call out that you just had there about, yeah, with like the patch stuff, because even,
Mhm.
lidocaine patches, but even nowadays too, like there's so much hormone replacement therapy and other things too, right? That are delivered like via patch
Yeah.
as well for patients. I would have never even thought about that. But that is a very, very, very good point.
Mhm.
Interesting. Or same thing too, like with liquids, right? So sometimes, yeah, that's a good point though too, because even like in the refrigerator, like if you have like liquid antibiotic stuff, or liquid, there's so many more like liquid multivitamins, and there's liquid vitamins out there nowadays too. And like I remember when I was a kid, is it, I don't remember if it was penicillin, whatever it was. Anyways, the one that tasted like bubble gum, that was like
Yeah.
liquid. And whatever it was, like it might have been penicillin or something, whatever. Anyways,
I
I
I
was
remember
I
taking
was allergic to it.
amoxicillin, I
Oh,
think.
amoxicillin. Yeah, I remember it was in the something family. But like
Mhm.
I was allergic to it. And so
Mm.
I couldn't have it. But I liked it. I liked the taste of it because it tasted like bubblegum. So
Yep.
I was at my friend's house one time, and my friend was took her little dose, and it was on the, bottom shelf or whatever in the refrigerator. And so yeah, we like went and got me some, and then I like had this whole hives, whatever. Like I had this whole reaction. I was like, what the heck? Oh yeah, I did that, and so yeah. Again,
Yeah,
public service announcement with the Dr. Jen Ellis show. Do not take anyone else's medication.
right.
Step one. But yeah, but to your point, even yeah, with the liquid stuff, even like in the fridge, like we were talking about too, like get it up, right? Yeah, get it up,
Mhm.
get it away, get it in the back of the fridge on the top,
Absolutely.
something like get it away to where a kid can't, yeah, like, drink a half a bottle that tastes really good, of like raspberry, I don't know,
Yeah.
multivitamins or something. Again, like it's gonna be way too much.
Yep.
So we're not
Yep.
thought about that. Okay, yeah,
Yep.
good call up. Yeah,
Yep.
this was wonderful. So thank you, thank you.
Thank you. Thank you. And I just want to say too, if anyone has any ongoing questions or, um, you know, want me to go over anything that was in this presentation or more, again, always feel free to reach out to me um, at it's estocky at St. Louis County, or you can reach out to or stlouiscountymo.gov, and you can always reach out to health promotions and public health research if you forget that. So, yeah.
Awesome. Well, thank you so much. And I just appreciate you, yeah, sharing all your knowledge and wisdom. And, if there's somebody, you guys in your life that needs to hear this presentation, please share it with them. And, definitely like follow us on our Facebook and our YouTube channel as well so that you don't miss really good educational opportunities like this that literally could be life-saving, as we just discussed. For you or, somebody in your life. So thank you all for joining us.
Thank you.